casting my mind back here, but we certainly had an exciting opportunity where there was a desire for the churches of Lincoln to be represented in various forums at the county council level with the NHS. But I remember being in a conversation where someone asked me, would you like to sit in one of these groups and represent the churches? And I said, well, I can't, because I can represent my own church, but I don't really know it, people in other churches, so I can't really do that well. We need to do some work ourselves first to get ourselves organised together. And the Faith Action Audit, which is a national charity, Cinnamon, as Mike has mentioned, Cinnamon Network, they were doing the organising these faith action audits in various towns and cities, which basically ask the question, what are churches doing and what's the contribution they're making, so that can be celebrated. And we had a celebration event at the cathedral, and quite helpfully the city council leader asked the question. He said, oh, it's great to see what all you churches are doing together, but is there any way of having one phone number or one contact that we can reach that would connect with all the churches? And that was the catalyst enough for us to get together and found what we called at the time the Active Faith Network, which me and others brought that together and created. But what was fantastic from that process is, as churches together, we were recognizing, oh, there's a few of us doing things in the same area, a few of us doing food poverty projects, there's a few of us doing things around health and well-being. And so let's bring ourselves together in these little kind of subgroups to ask the question, what is it that we as churches can do together in these areas? Where are the gaps? Where are things that we're duplicating each other's work? And the health and well-being subgroup had a real strong vision for, wouldn't it be great if churches could be places where, when people were really struggling in the evenings, when they were most alone with their thoughts and struggling, there's always somewhere that they could go. And around that time, as has been demonstrated elsewhere, is we were having that conversation, but then also the NHS was having the conversation about, who can we partner with? But they had seen that the churches had got themselves organised because of the work that I just described. They'd seen there was one phone number we can reach to say, can we connect with you? And so that connection happened from both directions. And a lady who's on that subgroup, Stacey Marriott, was able to bring forward this proposal, which matched up with the aims of the Transformation Fund for Lincolnshire. And as a result, a pilot started for Nightlight Cafés with my charity Acts Trust, which is now in its seventh year. And that really, I think, sparked an example of how it could work really well. And since then, we've also had the work with the community connectors and with Bridge Church. And I think we've been able to model an example of where this can work very, very fruitfully and both meet the aims for the local NHS, but also for the aims that the local churches wanting to do something together that's making a real difference.